Good afternoon, my name is Lissette Williams and my topic is extrapulmonary Tb. It's an infection caused by tuberculosis bacteria that has spread beyond the lungs.
Tuberculosis is pulmonary disease, is lung disease, but extrapulmonary disease is also very important. In fact, it's so important that
Infants and very young children and people infected with the human immunodeficiency virus, HIV, have an increased risk of developing extrapulmonary TB.
lupus, which is of course not an infectious disease, HIV infection, which is an infectious disease, Epstein-Barr virus infection, which is a
Application in medicine, we have the symptoms that this depends on the part of the body affected. The most common areas are lymph nodes, bones and joints, reproductive or urinary tract organs, and tissues covering the brain and spinal cord.
This one, we're going to focus on disease involving the lymph nodes and the genitourinary tract. And then the second one, we're going to talk about involvement of the bones, the central nervous system, the gastrointestinal.
The abnormal tuberculosis, this may involve the gastrointestinal tract, peritoneum, mesenteric lymph nodes, or genitourinary tract.
For reasons that aren't clear to me, often involves the terminal ileum and the cecum, so down there around the appendiceal area, with often a lot of lymph node involvement. One can have obstruction, and if the infection is not recognized and treated, it can erode through the gastrointestinal tract. So
Tuberculosis lymphadeninitis, this is a cervical adenopathy, is most common, but inguinal, axillary, mesenteric, mediastinal, and intramammary involvement all have been described.
Again, is the lymph nodes, and I'm talking about that first because it actually is the most common place that TB goes after the lungs.
Okay. The advantage we have their anti-tuberculosis therapy can minimize morbidity and mortality, but may need to be initiated empirically. Treatment duration may need to be extended for central nervous system and skeletal tuberculosis, depending on drug resistance, and in patients who have a delayed or incomplete response.
Are not that uncommon. Only 74% of all TB patients in the EU successfully finish the treatment. To help them through the process, patients need direct supervision from medical staff.
And this advantage we have that is a risk disease because it involves many organs.
This one, we're going to focus on disease involving the lymph nodes and the genitourinary tract. And then the second one, we're going to talk about involvement of the bones, the central nervous system,